Alright, so we're going to be doing a Rinne test here with George. One of the first things I want to do is make sure George is relaxed sitting here. And what we're going to end up doing is I'm going to slap the tuning fork against my leg, and then I'm going to put a vibration, the base of the tuning fork, I'm going to put it right up to the side of his ear. And then I'm going to slap it again, and I'm going to put it right up to his ear with the tuning side. And what's going to happening is George is going to tell me if one sounds louder than the other, or if they sound about the same. So we're just going to do the first part of it. We're going to do the bone conduction portion of this, putting the bass right up behind it. Can you hear that?
Yes.
Alright, so if you can hear that, now we're going to do, I'm going to try putting this one. Hear this?
Yes.
And which one could you hear a lot? Could you hear any of them louder?
The second one.
Okay, so that's that'd be considered normal. You can hear the tuning side a lot more louder than the bone conduction side. So this side right here is going to be considered the air conduction side. When I put it right up to his ear like this, that's going to be air conduction. When I put it up to his, when I put the base of the tuning fork up to his bony area near the ear, it's going to be the bone conduction area. And where we get problems is the conduction hearing. Is if the bone conduction is a lot longer than the air conduction. And another problem that we can get is sensory neural hearing loss, and the sound will just be a lot more reduced, and the air conduction will be a lot longer than the bone conduction. So that is your Rinne test. All right, the second hearing examination we're going to do is the Weber test, and the way this works is we're going to get the tuning fork. And we're going to put it right along the base of his forehead, or right here. And what I'm going to do is just slap it against me. And then I'm going to put it right here. And then I'm going to ask George if he can hear it on both sides. Can you hear this on both sides?
Yes.
Can you hear it on one side compared to another?
No.
Okay. So it looks like George has normal hearing just based on that test right there. Any type of impairments that he would have. So if I were to put this up to him, and if he heard it more on this side, or if he heard it less on one side, so let's say he heard it less on the right side, then George would have, we could assume that he had a conduction hearing loss on the right ear, or he could have a sensory neural hearing loss on the left ear. So yeah, that's it. Alright, so I'm going to be doing a throat examination of Raul here. One of the biggest things you want to get off right at the back is just make sure you have some gloves on, because you're going to be putting, you could potentially be putting your hands in his mouth. So I just want to make sure that you protect yourself appropriately. One of the first things I'm going to do is just check Raul for face symmetry and just make sure that he's fine. So I'm just going to have him look back. I'm just going to look for any abnormalities, any type of deformities. Just make sure that his face is asymmetric from his neck all the way down to his, all the way up to his face. So it looks like he's fine. Looks like there's nothing wrong. What I'm going to look for right away is his lips. And I'm just going to see if there's any dryness, any type of crackiness in his lips. That could indicate dehydration. So it looks like he's fine. The second thing I'm going to do is I'm going to grab my tongue depressor, and I'm going to pull down his oral mucosa. And I'm going to be looking for any lesions right here, any type of white plaque buildup, any type of redness, and any type of lesions I can find here, any white spots. And it looks like Raul's relatively fine here. You just want to find like that pink color, and that typically indicates that things are healthy, so that's fine here. I think I'm going to check is the buccal mucosa region, which is going to be right here. So I'm just going to retract this, and I'm going to look on the side of Raul's cheeks right here, the inside of his cheeks. And it looks like he's fine right here. I don't see any type of lesions. I don't see any redness. I don't see any swelling. I'm going to dig a little deeper just to make sure I got everything. So Raul's fine here. Check the other side just to make sure. No redness, no swelling, no lesions. He's fine. And then the last thing I'm going to do is I'm going to grab the otoscope, which I have over here. Typically, you should have this thing on you already. And what I'm going to have Raul do is just open up his mouth. Open up. And then I'm going to push down his tongue. And then I'm going to put the otoscope right here just so I can have a better view of his tonsils, his pharynx, and his uvula. I'm going to be looking for any type of redness, any type of swelling, and any type of yellowish color. And I'll tell you what that means in a second. So I'm looking at Raul's pharynx, looking at the posterior wall of his throat, his uvula, and his tonsils. Everything looks fine. Everything looks pink and nice. So if we have any type of redness or swelling, typically we'll have inflammation, infection, and things of that nature. Another thing to look out for is the yellowish tint that you could get in the back of the throat. It could be a sign of postnasal drip. And then for the lesions that you find inside, it's just white plaque buildup. You'll have like infections, things like cold sores, is what people typically call them, and any type of lesions. You'll have inflammation, swelling. So any type of redness will indicate inflammation or swelling. So yeah, that's what you look for. Alright, so I'm going to be doing a lymph node examination of George here. And one of the biggest things when you're palpating the lymph nodes is just to check for any type of tenderness, any type of swelling, any type of hardness of the lymph nodes. In healthier lymph nodes, you'll typically see mobileness and non-tenderness of the lymph nodes. They also won't be swollen or as large. So what I'm going to do is just go through the different regions of the lymph nodes in the head and neck area. So we're going to get that right now. We're going to start off with the preauricular up here in this region. I'm just going to palpate for them, and I don't feel any swelling. And then I'm going to go to the postauricular in the back. Looks like we're good right here. And then we're going to move on to the tonsillary region. And then we're going to move on to the submandibular region. And then we're going to move on to the submental region. And then after that, we're going to look for the occipital. And it looks like there's no swelling tenderness back here. And then we're going to move on to the supraclavicular. So it's going to be in between that clavicular groove right here. And after that, we're going to go infraclavicular. And it looks like we got nothing here. And then after that, we're going to check for the anterior cervical. It's going to be in that fold in the anterior side of the neck, in that fold of the sternocleidomastoid. And then after that, we're going to look on the posterior side. It's going to be on the little fold on the posterior side of the posterior sternocleidomastoid. And then after that, I'm going to have my patient rotate his neck. And these are a lot harder to find, the deeper cervical region of the deeper cervical lymph nodes. And they'll be typically right here. And it looks like I'm having no swellingness. I'm going to check the other side. And it looks like there's no swellingness or any tenderness. So George, do you have any type of tenderness with me touching you in any of those areas?
No.
Alright, looks like George has healthy lymph nodes. Alright, so I'm going to be doing a nose examination of George here. And one of the first things you want to do is make sure you have some gloves on. You want to take the precautions because you will be putting your fingers around a cavity, his nasal cavity. And obviously we didn't have enough gloves, so I just put one glove on just so I could be safe, but we would start off with 2 gloves. So another thing we're going to do right off the bat is just check for asymmetry of his nose. Make sure there's no deformities, any obvious deformities that could affect the exam. So I'm just going to palpate around the region, palpate around here. It looks like asymmetry is fine of this nasal region. Another thing I'm going to look for right away, just check his sinuses, make sure there's no inflammation, no tenderness. So I'm going to go right here. And I'm going to go right here and check his sinuses. Any tenderness when I touch?
No.
Okay, so no, I didn't feel any inflammation. He didn't have any tenderness. So it's a good sign that his sinuses are fine. What I'm going to do after that is compare his nares bilaterally, or his nostrils basically. And before you could even do that, you just want to make sure that, take a precaution, make sure he doesn't have an epistaxis, which is just a nosebleed. And looks like George is fine, looks like we don't have anything here. If we could just check real quick, make sure there's no blood in the region. But if you did have a running, bleeding nose, you would see it pretty well. But looks like there's no blood in the region, so we can go ahead and start off with the nares bilateral evaluation. And what I'm looking for is any redness around the nares or the nostrils, and making sure that there's no inflammation, no swelling. Looks like his nostrils are fine. Second thing I want to do is now check inside the nasal cavity and check his septum. And I'm going to use a speculum to do that, so I'm going to just turn my light on, make sure it's on. And then I'm going to tilt his head back so I get a clear view of his nasal cavity, and then I'm gonna check his septum. And his septum is relatively pink, and then I'm gonna look for any discharge. And if I see any discharge, I want to note any type of colors that it is, so that gives me a good idea of what could possibly be in there. So it looks like George doesn't have that much discharge, and even if he did, the things I would look for is if he had yellow, green, or brownish colored discharge, is a good sign of a bacterial infection. A second one would be a clear discharge, which would be a good sign of an allergic reaction. And then a third color that we look for is a straw color, which could be indicative of a head injury or a brain injury of some sort. And then one of the other things I want to do, just to make sure that there's no obstructions of the nares, is I'm going to put one hand over one nostril and then have him breathe. So breathe through the other nostril. Breathe out. Did you feel any obstructions, any type of, when you were breathing like that?
No.
Alright, so now I'm going to check the other side. And if he feels like anything's blocking, then he probably has an obstruction, but it looks like he's fine. So we're just going to check the other nostril and just make sure. So breathe in, breathe out. Any obstructions? Any blockage?
No.
Alright, so looks like he's relatively fine. Yes, so yeah, that's pretty much your nose examination.